Greetings and hello, everybody. I'm going to turn this over to Brittany. And if everybody could type in your name and your agency in the chat box, welcome and thank you for being here. We're going to go on and move and get things started.
Thank you, Dr. Tate. Well, welcome everyone. Good afternoon. I hope you're all having an amazing Monday. It's great to see so many familiar and new faces and names. So appreciate everyone's interest and support and being here. Thank you so much. And I wanted to first start by thanking the members of the Equity Advisory Committee for the San Francisco Human Rights Commission. So I know Dr. Tate just handed it back to me, but I would welcome Dr. Tate, Melinda, and Miranda to please introduce yourselves to the community members on the line, and we can talk a little bit more about the Equity Advisory Committee and how this work is supporting the Strong Starts Initiative.
Thanks. I guess I can start. Hi, my name is Melinda. I am a community development specialist at the Department of Early Childhood, and I'm also on the Equity Advisory Committee here with HRC. I am also a San Francisco native. I grew up here in Bayview, and I will popcorn it to Miranda.
Hi everyone, I'm Miranda. I use she, her pronouns. I work at UCSF in a project called Global Action Nursing, which is focused on maternal and child health. And I am also on the Equity Advisory Committee, and I'm really happy to be here today. Thanks. And I'll pass it to Dr. Tate.
Hi, Dr. Pamela Tate. Grateful to have you all here and to be here. I'm a member of the Equity Advisory Committee as well, and excited to be here and to be joining with you all and talking about maternal health outcomes here in San Francisco. Pass it back to Brittany.
Sarah, do you want to introduce yourself?
Hi, everyone. Oh, did you say Deanna?
Sarah.
Okay. Hi, I'm Sarah Singh. I'm the policy director at the Office of Racial Equity and we're one team within the Human Rights Commission.
Thank you. So Sarah and I are supporting the Equity Advisory Committee, and this is a subcommittee of the San Francisco Human Rights Commission. I see our chair just joined. Just want to give him an opportunity to say hi really quickly. Hasib.
Thank you, Director Chiquad. I want to thank everyone. My name is Hasib Emron, chair of this esteemed commission. Just really want to thank everyone for their time today, valuable time on such an important topic. We had a great Black Maternal Health Week celebration. I got to join a lot of community celebrations across the Bay Area, in fact. So I'm just really looking forward to the conversations and keeping the momentum going on not just being celebrated in one week, but year-round 365 days. Thank you.
Thank you. All righty. And so we are going to get started with our presentation. We hope that it's felt and understood that this is meant to be an organic conversation. Nothing that we're presented is, a final decision as far as the point that we are at in the Strong Starts Initiative, but we felt that it was important because this announcement was made in February to bring folks together, particularly prioritizing moms, birthing people, service care providers to come into the room together and share what we are starting to congeal around as a city partnership, but also obviously make space and yield to the communities that are experiencing the care. So I'm going to start sharing. Okay. Okay, thank you. So here's our brief agenda for today. We want to start with a Strong Starts Initiative overview, just talking about ensuring that there's shared language, because we've heard very clearly that not everyone is on the same page. What is the Strong Starts Initiative? We heard an announcement in February, but we haven't gotten any more information. What are you all working towards? And so wanting to be as explicit as possible about the definition of and goals of this initiative. And then what we've heard very clearly is, what is the budget? How much money are we talking about? And wanting to have space where we can discuss where people want to see investments, if there are, specific dollar amounts, as we are going through our own investigations to understand and transparently understand and revise existing investment, as well as recommend new investments. And then we want to review a community survey that we've drafted with you all to get feedback on the content of that survey. So to start, we wanted to acknowledge and just be clear that we are here as a working group, really because of community leadership. This is just one example of many. This is not a new topic in San Francisco, right? So for decades, we have known that Black, Native American, Pacific Islander moms and birthing people have not been receiving the care that they should when it comes to maternal care in San Francisco. And so I'm not sure if everyone is aware of or has seen the letter that Dr. Zaya Malawa and the Abundant Birth Project team organized around and had over 250 plus signatories. But in September, this letter was sent to the mayor, to the director of the public health department, to the health commissioners, and to the members of the board of supervisors, demanding improvements in San Francisco's coordinated maternal care programming and improvements to our health outcome disparities. So I just wanted to name and respect the community members that have gotten us to this iteration of addressing maternal care outcomes in San Francisco. But that is only one piece of it, right? Because we exist in the living and ongoing history of medicalized racism, and maternal care context in the United States is often discussed as, foundationally, J. Marion Sims is called the father of gynecology. But we know that his research was exploitive, that he performed non-consensual experimentations that were not anesthetized on enslaved women who were not only non-consenting patients, but also served as medical assistants. We also recognize that the eradication of granny midwives, midwifery has been around for as long as humanity has been around, before the institution of gynecology and the medical systems that we all participate in now. We had community midwives who, and in the United States, they, are the reason why gynecology, as we know it and understand it today, exists. But they were eradicated due to a really coordinated campaign to systematize healthcare when it comes to maternal care. And so the last image is of those three women, Anarka, Betsy, and Lucy, who we now name as and remember and acknowledge as the mothers of gynecology because of their experiences and contributions. But this is only a glimmer and a glimpse into all of the contributing factors to our experiences and outcomes and, poor performance in San Francisco. And so part of where we have, had a significant amount of attention is in our preterm birth disparities. And, as you can see, over time, the preterm birth rate is significantly shrinking for every population except for Black people in San Francisco. And our local health efforts to reduce preterm birth are not having an impact on Black, on Pacific Islander, or on Native American families. Pacific Islander and Native American families are not included on this particular graphic because that data is not available based on their small population size. But we know that over time, when we look at birth outcomes, that Native American and Pacific Islander birthing people are experiencing the same trauma, the same poor outcomes, the same poor delivery of care and poor experiences in navigating our services. We also see concentration in specific zip codes. So 94110, 112, and 124 have the highest preterm birth rates. And so this is just one of the outcomes that contributed to the mayor's decision to create this new structure to address maternal health disparities, racialized maternal health disparities in San Francisco. So what is the Strong Starts Initiative? This is a coordinated multi-agency response to crisis-level maternal and infant health disparities in San Francisco. And at its core, our goal is to bring every birthing person in San Francisco, ensure that every birthing person in San Francisco experiences a joyful, autonomous birth supported by respectful, dignified, and non-burdensome perinatal care. And we want to do that by eliminating racialized disparities in maternal and infant health outcomes. So this is how we are defining Strong Starts. As far as our respective roles and contributions, I'll start at the bottom left corner. You'll see additional communities. We're, in addition to this group, we are talking with health system providers as well as wraparound service providers. But for the purposes of this conversation, we are focused on communities receiving care and understanding your experiences, respecting your lived experiences as subject matter experts, but also looking to you for help guiding our priorities as we seek to improve the health systems and supportive care services across San Francisco. And identify implementation concerns and solutions, in addition to solutions, excuse me. The working group that I referred to consists of 4 partner departments. And so I want to pause here and just acknowledge and give an opportunity to say hi from our working group members. So we have the Department of Early Childhood, Department of Public Health, Department on the Status of Women, and the Human Rights Commission. So DEC, I saw Sulema. Do you want to jump on and say hi really quick?
Hello, everyone. I'm so happy to be here. And I'm Sulema Rubalcaba. I'm a program officer at the Department of Early Childhood with the Child and Family Wellbeing Division. Thank you.
Thank you. Teresa? Public Health?
Hi, everyone. My name is Navina Baba. I'm the Deputy Director of the Department of Public Health, and really honored to be part of this working group. And want to hear all of your thoughts on what we're trying to do here.
Thank you. Public Health, that's it? Okay. DOSW?
Thank you, Brittany. My name is Diana Roche, and I'm the Executive Director of the Department on the Status of Women. Excited to be here and listen to this conversation. We are working really hard on the women's agenda and that announcement, and this initiative is a key part of moving the work forward for women and girls in non-binary communities. And just want to thank Brittany and everybody that's worked on this really for the last, I would say, 10 plus, if not more, years here in San Francisco. So very excited to be a partner, to roll up our sleeves and try to figure out how we could do better in San Francisco. Thank you.
Alfredo?
Hi, everyone. My name is Alfredo Guante, and I'm the research analyst for the Department on the Status of Women. Excited for this conversation.
Thank you. And Mauli? I can't see. I'm not sure if he was able to get on yet. Okay. So those are the working group members, and we have been tasked with analyzing the feasibility of potential initiatives. So we want to make sure that any recommendation that we uplift to the mayor's office are community rooted and data informed. And we're looking at both existing programs as well as ideas around new approaches. And so that is happening by basically, as we gather feedback from our respective community members, identifying work streams to understand what we are spending right now, how it is being implemented and utilized by community, as well as how it's being received and where we can improve. And last but not least, we have our mayor's office, and that is represented by Peggy Moriarty. Peggy, you want to say hi?
Hi, everyone. Thank you so much for having me. My name is Peggy Moriarty, and I'm one of the assistant chiefs for Health and Human Services. My focus is everything cradle to career, but I have had the pleasure of working with our working group on strong starts as we really think about how we can set up families from day one to be successful. And a big part of that is really closing the disparities we see for our Black, Native, and Pacific Islander communities. So we're really grateful for you all for letting us be part of this work. And to Brittany's point, I know we very much recognize that we are building from all the work that's been done before us, and we're trying to take this as an opportunity for us to continue learning and figure out what works in this next iteration. So thank you for having us and for letting us be part of this.
Thank you. So Peggy's role is convening the departments, and the mayor's office overall is convening the departments in this new way to develop a coordinated and holistic strategy to make final investment decisions that are informed by the recommendations that come from the working group, and to also influence external actions, whether that's policy advocacy at the state level that we need to change, at the local level that we need to change, or external relationships that can support improving outcomes. And so, one example of that, which is also being led by Navina, is, working with our other health systems, right? So San Francisco City and County, we only have really influence over our Department of Public Health and General Hospital, but we have four, hospital systems, UCSF, CPMC, and Kaiser, that we want to bring together to ensure we address the care that San Franciscans are receiving in each of these health systems. And then before I open it up after this first part of the presentation, so these are our decision-making principles. So we're rooting ourselves in equity first, prioritizing solutions that reduce racial disparities in maternal and infant healthcare outcomes by centering those most impacted. And as we have said, and will continue to say over and over, this is prioritizing Black, Pacific Islander, and American Indian people. We value lived experience as subject matter expertise, and we want to ensure that community feedback helps to identify our systems gaps and recommendations, because the people who are closest to the problem are closest to the solutions. We understand that your experience, your time as parents, as providers is valuable. And we want to respect that in how it is incorporated into the decisions that the mayor ultimately will make. We want to prioritize decisions that can be implemented and drive measurable outcomes. And so what that means is that we're trying to deeply investigate how we are spending our money and why things are not working, and be honest and transparent about where we need to make improvements. And to that point, we want to have clear accountability. So every decision that gets made will be made with transparency around the responsible department, deadlines for implementation, and metrics for success that we're using. So we want to pause here. If you have a phone, I don't know if you're joining on your phone, but if you are able to take a picture of this QR code, we want to get your reactions to that first bit of the conversation. And in particular, we want to hear, how would you define success for the Strong Starts Initiative? And what are our best opportunities for engagement? So we'll give a couple minutes for folks to work through that quick survey.
The survey is also available in the chat box. If you need to press, you can link for it.
Thank you. This is the part where we needed the music, Dr. Tate, like you said. We'll have to have you singing like Vanna.
I will have music cued for the next one.
Thank you so much for letting us use your link, your Zoom account. So I'm just going to give a couple minutes. As soon as folks are done, if you can just put, a done in the chat, and then I'll know to start moving on. Hey, I see Liliana is quick. Give a couple more minutes until I start seeing some more folks jump in. But thank you. Okay, cool. 5 was the number in my head. Keep working on it. We're going to continue talking through the next couple slides. Awesome. Thank you for that. Okay, so I want to hand it off to my colleague, Dr. Oliva Roche, to talk about this beautiful visual that she and her team have created and to give a bit more context on how we are approaching our work streams.
Thank you, Brittany. So I first want to just start off with saying that this diagram is a reflection of a lot of the initial conversations that we've had with community, and it's a guide to be able to look at how we're centering a person within this initiative, right? And specifically how we're centering the Black mothers and infants that we're trying to actually support and to try to get to a place where we're eliminating racial disparities. So I do want to be able to just also share that aside from that, we will try to work with different communities that we're reflecting under the Strong Starts initiative, but it is important to be intentional in this diagram to say we're actually centering on specific communities in order to deal with eliminating the racial disparities that we've heard so much about in community that need to be eliminated completely in our city. So this diagram reflects a person-centered approach to maternal and child health. It's placing the mother, the infant, and family at the center of our work. And at the heart of the diagram is the idea that the outcomes improve when systems are organized around dignity, respect, equity, and the whole person well-being rather than fragmented services. The surrounding circles, what you see around the mother and the child, are basically integrated work streams that are necessary for us to support the healthy maternal and child outcomes in San Francisco and in our systems as a whole. What you're going to see in between each petal are sort of the elements that are also necessary or the concepts that are guiding us to make sure that every system works and talks to each other to once again come back to the mother and the child that we're centering in this project, in this initiative, and in this work. What you're going to see up above, you'll see care system, which really focuses on ensuring accessibility, coordination, and culturally concordant care, which means that we really need to be able to ensure that we're grounding ourselves in an understanding of culture, the community that we're working with. The care system is interdependent on that understanding for us to really be able to deal with the disparities that we see in our health systems. Community engagement, if you could just follow me as I go around each petal that you see around the mother. So community engagement is the next entity or just the next work stream that we're working really closely on to really focus on building trusted relationships, elevating community voices, and we cannot really move this forward without the community engagement and really the community wisdom that we have and the trusted relationships that need to be built in order to be able to make sure that our system really almost rebuilds itself. The next component that we're looking at in terms of work streams is research and data. We are looking into data. We're looking at the data that does exist, looking at data that we need to continue collecting in order to make sure that we're also providing a benchmark on how to better inform our work and how to get to a better outcome, or at the end of the day, how to reach our North Star to help families the best way that we can. Policy and legislation is another work stream that we're working really closely on in this initiative, where we're also looking at the structural changes and the supportive policies that unfortunately have occurred for a many long time and haven't supported our families or are founded from a different perspective that exacerbates some of the racial disparities. And so we are working really closely with our full team to be able to look at how do we change some of these policies and legislation to become more supportive, to be able to draw down more dollars, right? And to be able to work really closely on ensuring that we create a better system. And then the final thing is the wraparound supports. So that's a big component of our work streams in this initiative. We're working really closely with city departments to address the broader needs of families, and also making sure that it's not just a clinical care approach that we need. We have an understanding not only with the partners here at the table at the city level, but also from community, that we need to be able to do a full wraparound support that includes food and nutrition, looks at housing solutions, and many of the other areas of that basically are needed in order to deal with the support that maternal and infant care needs in San Francisco. So with that, this full entire component of what you see in front of you, again, at the center, we're hoping to be able to always stay grounded and focusing on the mother and the child and being person-centered first. And with the understanding that all of these elements need to work better together and integrated in order to support what we would like to see, and really at the end of the day to get to that North Star of eliminating the racial disparities that we see. It's meant to start a conversation, I would share. We've been trying to make sure that this is sort of a guided planning conversation and that we get better. And so again, open to any feedback. Thank you. And I'm here to answer any questions.
We did have two questions in the chat. One of them was from Nessa. They said, what does community engagement look like for this system to work? We often say that, but oftentimes don't see the collaboration with community-based organizations. And I'm not sure, like maybe that's something that we work on as a community, or do you have an answer for that one?
Yes, well, that's perfect lead up to this slide because we want to open this part of the conversation up to have that conversation, but I just wanted to first put this on the screen. So if there are things that you want to give feedback on anonymously, then you can use this link to do that right now. Otherwise, this is a perfect time to open up the conversation. Thank you for that overview, Dr. Roche, on our approach right now. But we'll also put that in the link in the chat for folks if you don't have a phone to click on this image. But thank you, Nessa. So community engagement looks like a lot of things. So one, it's prioritizing those who are providing care, those who are receiving care. Those who are receiving care, like I said, you are the experts of your experiences, and we know that so much of your experience is not just around like the clinical experience of perinatal care, right? There are so many other social determinants that contribute to a healthy pregnancy and postpartum and life cycle for your babies. And so we are planning to talk with folks both in kind of town halls such as this, where it's not just meant to be a presentation of, this is what we're thinking, this is what we're talking about, but to actually be in conversation and to listen. We are planning to join other tables, join other meetings, and so have started reaching out to various community organizations to see where we can come and listen and share, where we are in the process so far, but also listen and receive, are we in alignment? Are we like saying what the community still prioritizes? Like I said, this has been a conversation, an ongoing conversation for many years. Are we looking at old information, and do people, now care about a whole different set of priorities? We want to make sure that any, ideas that are starting to get solidified are still the priority for community. And then Hope, for your question around evidence, evidence or data rather, we're looking at everything from, community governance boards, community advisory boards, and reports that are coming from, different service providers, from the, experiences of folks receiving care, but also, you know, evidence as far as like what our outcomes look like and what journal data driven interventions are, because we know that none of this is novel. None of what you all are seeing is, new information or some special approach. It's just the difference is the city is now being more coordinated and bringing our approach to addressing the issue. So I can stop there. I saw a couple hands, Ocean and Jordan.
I just wanted to clarify when I asked about data, this has always been the stickler for me is how we define the data. So I was actually trying to get clarity on like, how are we going to define the data so that it actually impacts, because the direction we continue to take is that evidence based on the system and what certain numbers, and we don't take in the actual in between. Like I shared before, oftentimes a lot of these stories are labeled as miracles of what we're doing very well or what is working, and we're not capturing that data. We heavily capture disparity data rather than what's working. So I wanted to really understand how are we defining the data this time differently, and then how are we going to look to apply the data?
Mm-hmm. Ocean?
Thank you, Brittany. I really appreciate this call and clarifying Strong Start's mission and the beginnings of it and the openness to have a conversation. I am one of the public health nurses in San Francisco, working with maternal, child, adolescent health. And I clearly heard that DPH is at the table. I'm really happy to hear that. And just thinking that the initiatives sound like exactly what the public health nurses work with, and really encouraging Strong Starts to reach out to DPH to look who specifically from maternal, child, adolescent health could sit at the table, because I didn't really hear that being listed, and just a suggestion.
Thank you. Jordan?
Hi everyone. I think just like seeing this image and seeing the mom and the baby, I think of like how important the village and the community is to Black women and Black villages. And so when we center the mother and baby, which is really important, but what about the partner or the father or the other people in their lives that also need support so that they can show up strong for this Black mother? And so that was just my first thoughts when I saw it.
Thank you, Jordan. We just had a conversation about expansive definitions of family right before this call, so I appreciate you. Any other initial reactions so far? I see Anna's comment about appreciative inquiry being super important because there are things that are working and they're not always what get funded, the things that are getting funded. Thank you. So Dessa is saying another suggestion is to include social workers who come in to address diverse populations and complex social needs.
And I don't want to keep talking, but one other thing that I just thought about was like the investment into the communities that are serving these mothers as well. Like birth workers, Black birth workers, of like whether it's like professional development or things like that, of like how are we continuing to support the community's growth and expansion.
Ocean, is that a new hand or is that your same hand from before?
Oh, I'm so sorry. Let me pull it down.
Oh, it's okay.
Sorry about that.
Okay, so if folks want to continue to give feedback, I'm gonna again, here's the Menti link where you can, give us feedback there. And now I'm going to hand it back to Dr. Tate and Melinda.
Yes, and I just wanted to point out too that if you have any other reactions, you could put it in the chat. I am taking notes. I'm not just, we're just not like putting everything you said on the waistline. I'm taking notes. So even if we don't have an answer today, it'll still be in the notes and the records. Anyways, we are going to start with a little bit of like reflection time, and we want to hear from a couple of you guys. Just keep in mind that it's a lot of us on the call. So if you want to say something, either share it in the chat or try to raise your hand if you can. And so the working group is one reviewing, and we're going to one review existing programs to recommend improvements, and two conduct feasibility studies to recommend new ideas. So far, Mayor Lori has said he will not reduce the current maternal health budget. So that means that like no money will be coming out, but that I mean, no money will be like it won't be getting lowered, but that doesn't mean that we can't like move around things, allocate it differently, etc. So for today, I wanted to know a couple things. One of the first things that I wanted to know was where would you guys want this money to be allocated to? Like, what are the priorities that you've been hearing from your communities? What do you think the priorities are? Yeah, so either you can put it in the chat or you can raise your hand and come off mute. And oh, sorry, I don't know if you want to add anything, Dr. Tate.
I was going to say, I see a couple of things in the chat box that immediately struck me about investing in fathers' participation from the beginning, because the more engaged they are in the beginning, the longer they will be around for the long term and be better prepared to take on the role as a father. I think that's really important, and thank you for lifting that, Lizette. Mental health, especially postpartum, is also something that's big. And I wanted to talk about while we have the mayor committing to not reducing maternal health budget, there is no guarantee that he will not consolidate things. And I think that should be something that community should have say so in. While I appreciate Strong Start and it being, or it's sitting currently with department chairs and departments, I think that it is definitely missing community partners. I know I am getting jammed up all over the place around the city when I'm out and about, from community partners who are like, you're on the equity committee and what's going on and why aren't we being asked or involved or brought to the table for conversations around strong starts and what does that look like and how is that going to impact our community? And so I definitely would like that on record, because community is asking me, community is trying to hold people accountable. And again, no programs for us without including us. And so I want to make sure that that is lifted, raised, and everybody has a great understanding of that because that needs to happen. And in terms of a budget ask, I certainly believe that we should ask for, if we are coming forth with an initiative, what is the dollar figure that is attached to this initiative? We want it to be more than words. We want an investment. We want an investment in community partners. We want an investment in families. And so as we go forward with the budget ask, I don't know what you all want, but I would hope that you have some things in mind, which is why we put this out here.
And then I have some, we thank you for that, Dr. Tate. The first hand that I seen was Maya, and then the next person will be Hope.
Okay, hi everybody. Let me know if you can hear me. I'm in transit. I think the first thing that comes up for me around investing is, I mean, yeah, centering the birthing person and thinking about who's included in that village, in that community, thinking about training and kind of educating the community as a whole, right, around being able to see when things are right and when things are wrong. And then the other thing would be definitely to, I agree with the budget piece. It's like really putting your money where your mouth is, you know, in terms of like the priorities of that this group decides, you know.
Yeah. And I have a question for you actually. When you say education, like for like like people surrounding the mother or the village or community education, did you have any like specific education you will want to see in this initiative?
I
Or
think the first thing would,
sorry, go ahead.
Sorry.
Sorry.
I was going to say, I think the first thing I would imagine would be some sort of campaign just around, I always think about there was an organization that was teaching people how to take care of one another in an emergency. I'm not talking about teaching the people how to be a doula or a midwife, but to teach people, to educate people around, like pregnant folks are not like some anomaly, you know. We're also part of the community, but also how to, I guess, provide kind of mutual support, you know.
Okay.
If my neighbor is pregnant, yeah. Because even if childless folks, there's more and more childless folks, right? And so thinking about that, somebody mentioned to me from the community, well, they're not having no kids because they don't have the same kind of village, you know? And I think that's a misstep, especially in communities like Pacific Islander and Black communities. You know, we rely on one another, especially when the system does not support us, right? So.
Thank you for letting me pick your brain. And
no
then
problem.
The next person will be Hope.
Thank you. So I wanted, as we're going through this process, also like, how do we, while we're still trying to figure it out, have some form of protections for community? Because right now, it's kind of hard to navigate what it should be when like we're having all out assaults on communities, like the towing in the Bayview, you know, the different actions that are happening in the Tenderloin. So like how, in the midst of this conversation, do we also get the mayor to put a pause, not even a pause, to stop some of the things that are like aggravating these disparities and outcomes while we're trying to like build and adjust?
That's important. Do you think that those things like tie into like people having being more stressed out, like pregnant and stuff like
Oh,
that?
absolutely. Like people are waking, I mean, there's like assault of like towing people cars 7, 8 o'clock at night in particular neighborhoods. And we like when you even do the transportation data, and you look at like who needs their transportation, who needs their car, who struggles to be able to pay like registration, those kind of things. And then you're like intentionally having task force. So I'm not even wondering. It's in the midst of all of this because we're not talking about these elements of these harms of like the constant restarting of things, the lawsuits that continue to happen when we do start programs, the calling out of names like publicly, like how are we going to be protected in trying to protect our community? Because so many times, community right now, it's like we're getting exhausted from we're trying to hold up the community and we're getting beat up at the same time with like either our funding is being took or there's like some attack on our credibility, those kind of things. And I don't see that in an element of like what legal protection will we have when you say black in a city or you focus on things that are black, they come under attack. It is very difficult to even say that. And there are things that are happening that, yes, it's stress on both the community, and there needs to be an element of like mental health support for community too. The people who are upholding the waters and the waves from coming to our communities.
Yeah, thank you for sharing that. That is a really important aspect that I think maybe get put at the wayside a little bit. Did you have any other thing you wanted to share? That was it.
Yes, thank you.
Thank you. Does anybody else have anything that they feel like they will want to see come out of this initiative? We've been writing everything in the chat, but you're also welcome to come off of mute.
I see Nessa has her hand up, and I was going to say something after her.
Yes. Okay, cool. Nessa, you can unmute and then we'll have Dr. Tate.
Hi, this is Vanessa Correa, medical social worker with California Children's Services and the Department of Public Health with NCAH. My suggestion, is that growing up when I was a kid, I remember in urban neighborhoods we had like central hubs, resource hub centers in Sunnydale and Double Rock and in the Mission. You knew where to go to access resources, and there was computers set up so that we can walk parents through navigating whatever resources they needed, printer access. And so I think sometimes we as service providers need to go to the community and work at a centralized place uh, where you can connect with people in their neighborhood, because oftentimes, like someone mentioned, the traffic tickets or something that they're getting and all these other barriers like speeding. There's so many speed checks in marginalized communities, and that's to continue to keep the poor, paying these speeding tickets. I know it's to improve and all these cameras and stuff, but they capture uh, people of color, that don't have the registrations up to date, that are in a hurry to pick up their children from schools because they're working and, and all that. And so having sites where they can directly walk to or get to easily in their neighborhood would be ideal.
Yeah, thank you for that. I agree. Dr. Tate?
I noticed that the chat box is really flooded and I appreciate it. A couple of things that have been lifted is education, starting from early childhood up through parenthood, instead of having this big call for education when someone's about to give birth, talking about it a little bit earlier, getting people engaged. Um, Economic supports for families. Childcare is great, but there are other things and other than diapers, and childcare that need to be paid for when you're a new parent. Having the flexibility to be able to stay home for a little while longer to take care of a child who's sick, to be able to bond with the child, not just for the mother, but also for the father, and looking at economic ways to assist families with things like that as well were my thoughts. Thanks. We haven't said what our budget ask is, though. If we were to go to the mayor's office today and talk to someone in the budget department, what kind of money are we figuring we would want this initiative to have attached to it? I know we've talked in our EAC group, the Equity Advisory Council Committee, and we need to hear from you. What does that look like? What amount of money, or where do you think those investments should be put forth? We want to hear from you all. If anybody has any ideas, please feel free to shout them out, put them in the chat box. The budget will be finalized pretty soon, and we'd like to put forth a ask if we have one. I see Nessa's hand up and looks like someone else is behind her, but I can't see the other hand.
It's Maya's.
Okay.
I think Nessa put her hand down, so.
Okay, then Maya.
I was just thinking about when we talk about the budget and the mayor not decreasing the budget, but that we can move things around. It feels like once again being asked to do more with less, right? Like if it was an option to increase the budget, I fear that if we reshift things and we take away from some area that's also needed, you know?
I hear what you're saying. I think, a lot of us are CBOs and have real budget struggles. And I get that because believe me, my org has real budget struggles. But I'm feeling like, there's money for overtime. There's money for additional supports for law enforcement and calling it public safety. I feel like there should be investment in public health as well. And so maybe that is an area that we can move money from and move it towards people, right?
I agree.
We have a question in the chat. I'm not sure if I can answer this, or I don't know if anybody on the call can answer, but Sienna said, is there any flexibility with the budget with the city in its current state? And I know that we are able to reallocate money. I'm not sure about the flexibility of increasing, but I don't know if anybody has an answer to that, or maybe we can put that on the
And if
fly.
I can just give it more context, right? I
Yeah,
work
of
for the
course. Yeah,
city.
go
I
ahead.
currently sit on a lot of meetings with city official leaders and very concerned about the mayor committing to um, the initiative, right? Like I'm all for it. But with you guys questioning how much can we bring forward? Is there an amount that he's already allocated to Black maternal health? And if so, can that number be communicated to the group so that people have a better understanding? Because from what I have been told is that the budget is very tight. So just concerned about if there's any flexibility when it comes to that. So understanding you can allocate, but how much money has been set aside for it.
What I can speak to at this point, and I will acknowledge we are in a tight budget cycle, and that is the reality that we're operating within, but we are looking at specific areas where we would be able to make selective investments specifically in this population. So one of the things we are talking about right now is additional housing supports, for example, for families and for pregnant women in particular. We're exploring other areas where we can make selective investments around economic supports, et cetera. But I think part of also what we're trying to get at with this idea around also wanting to explore reallocation of funding is in part realizing we do invest in maternal and infant health, and we have a lot of programs in San Francisco, and trying to figure out what's working and what's not, because we realize that what we have right now is not always having the impact that we desire. And so I think that is part of the conversation, is trying to look at where we are spending funding and figuring out if that's if there are better places for us to allocate. So I think it's a both and. We are looking at opportunities for selective investment even in a tight cycle, and we also think there are opportunities for us to do to leverage our funding better.
Has your office had a number in mind or something, or was that something you're looking from us?
I think where we're at, especially in this budget, like there's a lot of I will just name, there's a lot of moving pieces up to the June 1st budget decisions, but I know that there have been places that we've been identifying for some specific investment, whether it's for this upcoming year or for the 2-year budget cycle, within a couple of different places. But I don't want to name a number until the process goes through, because there is just enough uncertainty that I can't speak to some of the specifics yet.
Okay. Um, there are some other stuff, but it's getting lost, so give me a second. I wanted to make sure that I'm not leaving out anybody's questions or anything.
I saw a budget ask of 5 million.
Bam. Okay. Okay. So I'm just,
In
and
the
I'm taking
chat
notes. I'll
box.
put that down.
I would just
Will people
add to what Peggy was saying, that she has also, and Navini, please jump in to correct what I'm saying, but she has also asked DPH to really clarify what all the funding sources are, because, for my own learning, like it's a web of resources. It's what the city allocates to DPH. It's state funding that we can match or draw down based on our clients. It's federal funding that we can leverage too. And we're not always leveraging all the money that we have an opportunity to get access to. So I know that Namina and the DPH team are working hard to clarify, and we have asked that be a presentation at a future date once they are at a point where they have a handle around all of the, budget opportunities. But just want to share that part too, that, the ask has been made to have a clear presentation of what is the budget, how big is the budget, and where can we even, what are we even talking about? Because I think, yeah, that sounds great. $5 million, but it's like, all right, do we have access to that right now? And so it's not to say, to your concern that you raised, Maya, that it's not to say that we're necessarily going to like take some money away from a program that is doing well. It's to say, let us be more clear about how our programs are being implemented currently.
Yeah, and I can add to that. Thank you, Brittany, and Peggy. We do spend a considerable amount of money, and we do allocate a considerable amount of funding to maternal and child health, and specifically where there's disparities. And we far exceed, when we talk to the state, any other county in terms of providing funding, but we're not seeing the outcomes. And so there just seems to be, it's not translating to the people on the ground. And I think that's one of the things we want to come to you with, is like, if, and we can do a future presentation of, and it's not just DPH, as I'm learning, a lot of departments actually also provide funding, surprisingly enough. And so part of it is where are we as government and as city agencies not really meeting the people that need this support? How are we not meeting it? And how do we do better? So I think part of it is even just telling you all the different programs that are out there. Because when I started on this journey, it is really astounding how many people are in this area, and how many people are doing really good work, but somehow it's just not translating. Whereas in other jurisdictions, we just talked to Alameda today, they're spending far less, but it is much more potentially cohesive. Or I don't know actually why it's not working in San Francisco per se, but I think that's part of what we want to discuss with you. It's both what do we need to add, but also how do we do better with what we have, because it's doesn't seem to be making the change and meeting the people that we're trying to serve.
Mhm. I was mid reading. I see a hand up, two hands up. So the first hand is Anasia, and then the second hand will be Hope.
Hello, all. My name is Anicia. I am a PI specialist at Laguna Honda, just to give myself a little bit of introduction. But my question was regarding CWAPI methodology, program evaluation, A3s, just to know what it would look like to kind of ensure that, that we're doing what we said we're going to do, that we have, the just just kind of having that way to kind of project map it out, and just curious to see what it looks like. Um, because I'm always down for this kind of work, but I always know there's gonna be someone that's gonna have a negative thing to say about how important it is, uh, and about how important this work is. And I always want to make sure I have some like a Uno reverse card. And sometimes having copy quality assurance, performance improvement stuff is that, reverse card that you can whip out to flip it on people that have something negative to say about the important work. So I was just curious just to see what that looks like. Thank y'all so much.
Yeah, thank you for the question, Anicia. I would say we're at the beginning of defining what our methodology will be to both measure impact and how we communicate that with not only the folks who are receiving care, but also how we are measuring the service delivery. Because I think your question goes to, how are our systems being held accountable for these outcomes? A lot of times the conversation can be around the individual, and like comments were made in the chat and verbally from a real deficit mindset about merit and deservedness or personal responsibility and personal actions, but we know that these are systemic issues that are driven by individuals and systems that are not coordinated, biased, racist. And so we are just starting to define that and welcome that feedback. And hopefully, like when we have our smaller group meetings as well, I mean, we're writing this down now, and we'll incorporate that into how we're thinking about our approaches, but want that uplifted in these smaller conversations as well, smaller stakeholder meetings. But thank you for raising it.
We're going to transition over to the survey now, since it's the last quarter of the meeting and we've had people who've already had to leave, so we don't want to not go and run through that.
Thank you. Well, Anna had her hand up. She hasn't spoken yet. Do you mind if we go to her?
Sorry about that. Of course.
Thank you. I'll try to be brief. Anna, midwife from San Francisco General. I think one of the things that we also need to be aware of is this issue of although multiple stakeholders, agencies, CBOs, collectives, et cetera, input should be part of the final product. I also am a little wary of having like so many different funding streams going to so many different places, because that's what our patients say is challenging to navigating the current system, is that there's no unified front door for folks. And every agency and group has its own intake process and hours of operation. And it just creates a lot of frustration for our patients around that. And it really also leads to issues around, patients having to repeat themselves over and over again. It's very invasive. There's a lot of issues of privacy that, they're required to reveal a lot of intimate details, and they have to do this over and over and over again in all of these different spaces. And so I really think that, although the boots on the ground kind of grassroots frontline folks, definitely there needs to be a lot of input there. I feel like we also want to think about how do we streamline it for the people who are actually accessing the services, so that they're not having to like piecemeal and patchwork this web of support together for themselves, and the web can just exist for them in the way that it needs to based on their needs.
Thanks for that. Any last thoughts before we transition? Going once, going twice. Okay, we can transfer over to the survey now. Yeah, so you could just scan this link
Sarah,
here.
I don't know if she's still on.
Oh,
Sarah?
I'm still on. I'm about to share my screen. But yes, there's a QR code on the screen. For those of you who have your phones handy, you can also use that to preview the survey. Oh, thanks. All right, here we go. So to help people learn about Strong Start and what the scope is and what the dream is, we wanted to do a really short and simple community survey. It's just meant to be fast to get people interested, to give us a snapshot of what folks are thinking and feeling right now. It's not meant to be like a really long questionnaire or study. And at the end of the survey, it also invites people to sign up to receive more information about Strong Starts and come to community meetings and stay involved. I think the analogy that Brittany and I have been talking through is, it's election season. I get spam calls where they say they're spam. I get calls every day, all day long, and people are knocking at my door. And, sometimes they say like, hey, how are you feeling about, your rent or how clean a street is, et cetera. It's meant to be same sort of thing to get the conversation going. So the first, oh yeah.
Could you put the QR code back up? Or is that coming? Because it was up for a second.
I can actually put the link in the chat. Let me stop. Actually, let me exit the preview. Share the link. Put it in the chat. Okay, how's that? Okay. So the first section is all about the types of care that people have had access to so far during pregnancy or postpartum, where they seeing doctors, midwives, doulas, community birth workers, and so on. We also ask, what types of locations or facilities were they getting care at? Was it the hospital system, a private clinic, a public clinic, a birth center, or at home? We also ask, where did they deliver, if they delivered in the city? And then on this page, there's a very long question at the bottom where we're asking, what types of supportive services did they use during pregnancy or postpartum? Like birth classes, telehealth, home visits, mental health support, and there's a list that keeps going. Did they use these services, or was it that they wanted these services but couldn't access them? Or was it that actually they weren't interested in this service? So this is the first page. The next page is about their experiences with care in the city. We asked, did they experience any challenges during pregnancy or postpartum with the care they were receiving, and what kind of challenge was it? Was it a lack of culturally competent care? Was it not being able to see the same provider again? Insurance coverage, cost, appointment times, wait lists, and so on. And then we ask, how often do they feel treated unfairly or disrespectfully by healthcare and services staff? And how often do they feel supported? And so for both of these questions, there's a follow-up question for folks to share more if they've had this experience. So for instance, if I say, I felt disrespected actually quite frequently, there's an optional open-ended response there. Third section is about people's ideas for what should change. And this is, again, just to get an initial sense of what's on people's minds. So there's a list of different types of improvements here, like more culturally concordant healthcare providers, more access to doctors, midwives, doulas, training for healthcare staff on bias and respectful care, more out-of-hospital options, more community options, mental health services, paid leave, financial support, penalties for pregnancy discrimination, which is something that we've heard a lot about at the Human Rights Commission, people being discriminated against by their employer or landlord, housing assistance or support, food access, transportation assistance, family planning services, and also space for folks to just fill in the blank. And then this last question is just an open-ended space. If you could share one message with decision makers, especially the mayor, about what would make pregnancy and raising kids safer for your family or families like yours in San Francisco, what would that be? The last part is just some demographic information. It asks if people are pregnant, postpartum, parenting, if they've ever experienced any of these challenges with pregnancy, birth. It also asks if you've ever worked in any of these roles for pregnancy care, such as providing services, a doula, a licensed midwife or certified nurse midwife, a nurse, nurse practitioner, physician, or other. And then it asks about race and ethnicity background, as well as the zip code that folks live in. So this is quite a bit. We wanted it to be short, something that folks would feel interested in filling out and sharing. And so it'd be good to hear, yes, which of these questions feel really relevant, which maybe feel like too much at this point. And at the end of the survey, it links to an email sign up. And this is a separate form just to keep all the answers anonymous. This is a place for folks to put in their name, their email, and if they've ever worked in pregnancy care in any of these roles. All right, I see there's a lot of thoughts in the chat. Melinda or Dr. Tate?
Yes. It's somebody had asked, sorry, I just lost it. I'm bad at this chat stuff, guys. I'm sorry. Where did he go?
And I should ask mine. Can there
No,
be a
sorry, go ahead.
question? Can there just be a question around insurance? Because that's something that gets lost in a lot of the conversations. And so, like, if you have private insurance, you don't necessarily have access to everything. And then there should be something around like the access, because we have developed this great system for Medi-Cal programming, but everybody is not on Medi-Cal. So that should be like an element of it.
Oh, can you say more about the private insurance question? How would you, tell me more about how you might ask it.
Okay, so for example, if you're a Medi-Cal recipient, you're considered, you qualify under low income. If you're not a Medi-Cal recipient, you don't qualify for a lot of resources. And also you aren't entitled to a lot of the same quality care. So like some hospitals might have a whole array of things that focuses on low income because they have categorized low income as just Medi-Cal recipients. But when you really dig to look into some of the birth outcomes, it's also associated with women who have private insurance, but they have to go to select hospitals, or you're like in a Kaiser system where you can't go to any other hospital. So having a very question that is focused on insurance will really play a critical role in being able to see how we're able to access, who's getting access to certain things, and how that is also playing a role in the disparities as well. Because if you're locked into Kaiser, because Kaiser was the most affordable one, you don't have access to the other programs, or you don't have access to, I can't go to the Black woman clinic because they don't have that at Kaiser. So the insurance question really is a critical part of that and like
Would you like
having
to
access.
would you like to know the name of their insurance plan as well, or the like PPO, HMO, or just public versus private? And I
I
can also
would,
follow up with you offline. Yeah.
yeah, let's do that offline.
Okay.
Um, and then thank you for that, Hope. And also people said, Jay said that mental slash behavioral health is missing from the list of roles, and also public health nurses.
All right, great. I will make some notes right now and then we can fix the formatting. Mental health.
Mental and behavioral health.
Okay. Okay, that's
And
great.
public health nurses. Yes.
I
And
have a
yeah, go ahead.
follow-up question for folks. Would you, if you were taking the survey or helping someone fill it out, would you rather have this question about their occupation as they're sharing their experiences? Or would you really like to have it during the email sign up, or do you like to have it in both places? I'm sorry, I've lost the chat temporarily. So folks don't have an opinion or a reaction on that right now.
I
That's
think
fine
Both.
too.
Both.
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 Okay. Okay. Thanks.
Mm-hmm. And then also wanted to uplift some stuff people said in the chat. There should also, we had, you captured good stuff in the survey, but there should also be opportunities to include fathers slash partners through a companion survey, or maybe a different section. Can help identify home stress, postpartum needs, resource gaps, and ways fathers can better support mothers and babies. That seemed to be a really big theme tonight too. So, um, and tell me if I'm going too fast, but also we have somebody says employer-based or commercial insurance is usually how people refer to it. Oh, I think that was like a continuation of the insurance talk. Okay. Okay, cool. I think that's pretty much it.
Okay, that's wonderful. That's really helpful.
Oh no,
And if
somebody,
folks,
sorry,
oh, go ahead.
something just came in. It says, has the committee done a deep dive on the ACOG and other health authority best practices? Health authority policies determine what insurance would pay for, which in turn determines what providers offer. So I don't think we've done a deep dive in that quite yet. But I can definitely look into that.
Jody,
ACO.
I think that's a good question. I think some providers, especially advocacy groups, have been talking about, have informally mentioned to us, yeah, things they're working on with policy change and insurance coverage. Yeah, so I think that's something that is part of this initiative. We should all definitely talk about more.
And that was pretty much it in the chat.
I also have the Menti open. Would folks be interested in seeing what people have responded so far on that?
I think that maybe we can send out an email because we're hitting up against the end. And so as part of our thank you email, we can include our notes on the comments and those that anonymized feedback through the Menti. Thank you.
I think that's great. I want to say we had 61 people on here at one point. I'm extremely proud and grateful for everybody who gave of their time because it's Monday and Mondays be Mondaying, you know? And so I'm going to give it to you to wrap us up, Brittany.
Well, I saw 67 at our height, and my oldest son would love that number. So thank you, everyone, for your time. Like I said, we know that your time is precious. It's the end of the day on a Monday. And we appreciate all of the feedback. We want to continue to hear from you and not for anyone to feel like we are making just any decisions in a vacuum. And to just continue to share with you what information we have, because I like to Dr. Tate's point, we're all having our different conversations, and please trust that we're leading with our, with our best intentions, and a lot of this is just starting to come together. So there is no, I can speak for myself, but I believe I can speak for the working group. There have been no decisions that have been made without first tempering it in this space. So thank you for your guidance, your feedback, your wisdom, and participation. And so we'll send out what we have heard in the chat, in the Menti, and by voice, and we'll be in touch with those who have said that they are available and interested in helping with circulate the survey. Please reach out to us if you want any more information. In the meantime, you can email racialequitysf@sfgov.org. And I hope you all have a beautiful evening. Thank you.
Thank you.
Thanks, Dr. Tate, for hosting and facilitating.
No worries. Sorry. Yeah.
Was that spicier than you expected, or?
No, it was actually pretty calm.
I thought it was calm too. I
It
was
was
like,
getting, and then it was like, okay. And then I said, let me just say it, because then we don't have to worry about So yeah.
yeah, I
I
thought
was like,
I
it,
thought
thank
hope
you.
was getting ready to ramp up. So I was like, let me just make the comment. And yeah.
no, I appreciated how you facilitated, and um, even thank you for just prepping us in that way, because at first I was like, okay, I was kind of anticipating that, but then you saying it made it more real. And
Mhm.
then when you opened it and there were immediately 40 something people and it kept growing, then I started getting nervous. I was like, oh Lord.
Yeah, they were
And
talking about
then
a pregnancy village this weekend.
I mean, I'm
And it's
happy
good.
that people are,
It's good.
yeah, I'm
Yeah.
happy that people are aware, because to me, like the showing, for one, adds with, our credibility, our
Mhm.
outreach, and the interest in the
For
community.
sure.
But two, it will help empower all of us
Yeah.
to be more vocal,
I
not,
felt like Peggy needed to see that. I'm not worried about the two of y'all. And I know Dr. Aroche pretty good. It was more like
yeah, this is not,
people are talking,
yeah,
right? She's not in community.
right.
And so that was, yeah. I'm glad she got to see that even though she left early. But
I
yeah.
thought you posed the question about budget really well, Dr. Tate and Brittany. Yeah, I'm glad that you put Navina on the spot a little bit. I really wish they'd put out a number, because the number is humongous. It is so large. I have the sense people are thinking like, oh, 7, 10, 20 million. No, the number is huge. We're
It's
just
larger
not
than that
seeing
little
it.
$5 million ask, because I was like, if we're talking about restructuring, um, you know, I don't know. Wow.
Yeah, it's over 50
Yeah,
and they're still counting.
they
For
said it
less
would
than
take
4%
months
of the
to
births in
count.
the city.
Well, no, that's all maternal health.
Oh, okay. I
But
was like, what
but
in the okay. Yeah.
yeah, but when they presented it to us, it wasn't broken down by like public or private insurance
Okay.
or by race. It was they're trying to make an accounting of all maternal health. But we know that a plurality of participants are going to be people who are on Medi-Cal. So,
Right. I appreciated she lifted that because I was thinking my first child, I was a student. I was a senior in college and I had
mhm,
Medi-Cal. There were
mhm,
so many things available to me. My second
right.
child, I was married
You
with
were
private
priced out.
insurance, and literally it was enough to pay the co-pays and make sure I had the stuff I needed to bring this kid home. We
Mhm,
didn't have any extra like clinics or um, Lamaze classes or things to kind of like check on mom's health or birth stress. So I was glad they lifted that. And granted, it's been years, but I know that is a very real struggle between private insurance versus having low income. And a lot of low income programs, even if you have private insurance, it's low income to me, right?
mhm.
You don't qualify.